Dr. Shehla Ebrahim is a family physician who is passionate about helping men and women not only stay healthy, but also look and feel more radiant and energized, which is one of the reasons she has expanded her practice into a Medi-Spa direction. It is my pleasure to welcome Dr. Shehla Ebrahim to Studio 4 to tell us more.
Thank you.
And I know you've climbed Everest too, and for you to be on television for the first time is like climbing Everest.
It is.
Or is it that tough?
It's frightening.
I know. We've all been through that.
But I've heard you're a very good conversationalist.
Well, the great thing is about the host, if the guest doesn't talk, the host has to.
Okay.
So you've always got a safety net.
That's right. I'll let you do all the talking.
Okay, fine. I know nothing about dermatics, but why did you get interested in the field? I know you're a physician trained in family practice.
Yes.
What interested you in beauty and wellness?
Well, I was doing full service family practice for about 10 years. And then I felt that I had a need to do something different. I felt I had a creative and a very artistic side to me that needed to be explored. And the area of aesthetic medicine seemed quite appealing at that time because number one, I love skin. I can't get enough of it.
Right.
And number two is it would allow me to blend my creative and artistic qualities with science and technology. So in about 2005, I took a leap of faith and opened my skincare center.
And who trained you, or how did you train, or what do you need beyond a medical degree?
I took some extensive training throughout USA, joined many workshops. I was actually trained once with Dr. Jean Carruthers.
Right.
And most of the training was sort of not, it was in States, and some of it was in Canada. But there's no formal training as such at the present time.
Okay, but it's important that you go to somebody who has some knowledge. Dr.
That's
Braun
right.
has always told me that he's the Vancouver
That's right.
Skincare Center, and as you know, he has a degree in neurology.
Yes.
I believe neurology, and his wife is a dentist.
Yes.
But they're in the skincare profession.
Correct.
And it's so important that you have well-trained technicians.
Yes.
And all of that. So the latest. There's so many options. Alt therapy.
Alt therapy, yes. I'm really excited about this technology. It's actually using ultrasonic waves to deliver intense energy at a very deep level in your skin so as to tighten and gradually lift it over a period of 3 to 6 months. It basically stimulates collagen, remodels collagen, but it's not for everybody. Typically, it's an ideal candidate is somebody between 35 and 60 who's noticing some sagging and some laxity, on the forehead, some drooping of the eyelids, and wants to just look and feel better. It doesn't replace plastic surgery, but it's certainly an option for women who want to sort of slow down the clock, so to speak,
well,
and not necessarily stop it.
Right, and the trend seems to be non-surgical facelifts,
Yes.
like anything but the knife.
That's right.
And I was told by Dr. Braun that, if you have a facelift with old skin or tired skin, you're still going to look a little old and tired.
Exactly.
But if your skin is vibrant, because we really want to look fresh and vibrant and a little bit younger, but not 12.
Yes, and I think that really is the trend these days. Women want to explore non-surgical options. They want non-invasive procedures. Women want to look beautiful.
And men too.
And men too. And I think the pursuit of beauty is a global phenomenon and crosses all cultural barriers, all ethnic barriers. But they also they want to look natural. They don't want to look frozen or and because that's scary.
Very.
And you see a lot of women walking around with expressionless faces, and you kind of wonder what went wrong. And I think most women want to look, they want to have Botox, they want to have fillers, they want to have some kind of tightening procedure, but they also don't want to look like they've had something done.
Not too much.
Not too much.
You want somebody to say to you, have you been on an exotic holiday? You look so good.
That's right.
Now, part of that is internal, as you know so
Yes.
well, what we eat and if we
Yes.
exercise and all of that. But sometimes if your collagen is, and I assume as we age, collagen diminishes.
Correct. I think the concept of beauty has also evolved over time, and the notion of women trying to what they are now is very different from what it was 50 years ago. Women now are moving continents, they are changing careers, they are going back to school, they're competing in the workforce with younger women. So there is a need for them to look youthful. And a lot of women, when they come to me, they talk about feeling tired and having saggy skin and looking sunken. And I think there are ways to alleviate that and to soften their appearances.
Sure. So back to alt therapy, does it hurt?
Yes.
Darn. How much?
Well, it hurts to the extent that you have to manage pain. It's not, so I use different techniques to managing pain. I give them analgesics, I give them topical anesthetics, calm them down a little bit. But once you get started, it's okay. And I had mine about 3 weeks ago. And the areas that hurt the most is along the jawline and along the forehead.
It feels like snapping rubber bands, or?
No, not necessarily. No. That's more like intense pulse, like what you're referring to. It kind of feels warm.
Okay.
But it's, once you manage pain, it's very comfortable.
Sure. It's really irritating more than painful, would you say?
No, it's not irritating either. It just
it's
feels
just a little bit painful.
It's painful because it's going to a level of about 4.5 millimeters beneath the surface of your skin. And so it's tending to stimulate collagen and remodeling it. So it does hurt. There's no way around it.
Okay,
but
the body, the body is saying, ow.
That's right.
I better make collagen?
Yes.
Or what?
Well, the body says that I'm delivering this heat, and your body the brain recognizes that as an injury. And so there are some scavengers, the cells in your body tend to remove the injured tissue, replace it by healthy fibroblasts that lay down the new collagen. So, it doesn't work for everybody. I don't know if it worked for somebody who is 70 or 75.
Right.
Because there is only limited amount of fibroblasts that you can actually produce. That's just my opinion, although I know that they're doing alt therapy for 70, 75-year-olds. And I'm not really sure if that it would work for those people.
So back to intense pulse light. We'll take a break, and when we come back, we'll talk about IPL. I've had 2 treatments.
Great.
Do I look 12?
You look fabulous. You look like $1 million.
Yes, of course. We'll come back. Dr. Shehla Ebrahim is our guest. She is in the Medi-Spa business. Can I call it that?
Yes, of course.
In a sense. You're also a family physician in practice.